To those of you in search of babies, you are in a relationship, you are married for quite some time and you don't have a chance to conceive, this is your time. My name is Dr. Frank Kamanzi from Kafra General Hospital. Today, I want to talk about the challenges in marriage, especially that involve looking for a baby. If you are a couple and you have tried to have kids for quite some time, it may be 6 months, it may be 12 months, no baby. In that case, we shall say that you have a problem of infertility. Infertility is a problem for both of you, woman and man. It is not in order for one of you to say the other one is not able. Don't make a judgment so quick. It's a good thing for you to do thorough examination and find out the problem. There are two types of infertility. We have the primary infertility and the secondary infertility. Primary infertility is where a girl or a woman ready to give birth, at the birth-giving age, you are not able to conceive. If you've never conceived in all your life, then you have primary infertility, as long as you've been trying to have a baby. And secondary infertility is whereby someone got pregnant before or they had a baby and then the next time they are trying to conceive, it is failing. That is secondary infertility. So you can check yourself. If you're one of those, you can get back to us in the comment section and let us know. Feel free to ask any question about infertility in the comment section. And in the next episode, we are going to take you through the different causes of infertility in males and females. And we shall tell you if we can still correct your problem. My name is Dr. Frank Kamanzi from Kafra General Hospital. I'll be back in the next episode. Among the causes of infertility in females, one, we have infections. Some people have a lot of infections. It may be vaginal infections, it may be uterine infections, it may be infections of the fallopian tubes, which you call salpingitis. If you have low abdominal pain and the doctor has told you that you have an infection, and then you have been looking for a baby for quite some time and you don't have one, there could be a problem related to an infection. It's always good you come for a checkup and we find out if really infections have something to do with your infertility. Another cause of infertility in females is hormonal imbalance. We have hormones responsible for you to get pregnant, and some of those, we have progesterone, we have estrogen, we have luteinizing hormone, we have and other hormones. So if any of those hormones is not in the right quantities in your system, it could affect another responsible for conception. So hormonal imbalance is a big problem, especially those who have been using hormonal methods of family planning. It's always important. Tell your doctor about the history of family planning, whether you've been using a hormonal method of family planning, like the injectable Depo-Provera, like the pills, like the implants, and like the even those using emergency pills. So sometimes we talk about emergency pills and some people are using them excessively. You're not supposed to use more than 2 pills in a month. Emergency means you're using the pill in case there is a problem, something happened unexpectedly. You cannot allow an accident to happen every time and every hour. So you don't use so many emergency pills in one cycle. Actually, one cycle should have only one emergency pill. And if you feel you must not do without that pill, then you can resort to family planning. However, it is also another cause of hormonal changes. And hormonal changes can also cause infertility in many women. Another